Hello, hello, hello. DAZ Jones coming back to you. Not live. I'm going back on YouTube. Purposes that don't worry the public. But okay, so I am the founder of Do You Part Coronavirus. I am DAZ Jones. You can find me at www.facebook.com/DAZ Jones, the number 4 and L.I.F.E, right there. And you can also go to lifeisthekey.com for tips to stay safe, tips to manage stress. You can also follow the video links and some notes that I was taking previously back in like March and April, my daily notes of things that I was finding out about the virus. So then I kind of started switching over to live feeds on Facebook and some YouTube videos. And now I'm trying to go back to doing the YouTube videos. Okay, so that being said, I just concluded my study on Remdesivir, or my research, should I say, okay? First, I just concluded whether or not, sorry, I've been pressed for time, I had a lot going on, but, like in my personal life, but, I did do some research on Remdesivir originally, and put out a previous video regarding the fact that it is effective, but it only shortened by 7 days in the study for COVID patients, right? That was all I figured out at that point, whether or not it's got side effects or anything like that, associated deaths. This is what I just concluded in my research. Remdesivir was originally designed for Ebola patients, and they stopped the study because there was too much death. Now, they tried to say during the study that that death was from Ebola. Basically, it was just ineffective against Ebola. That's what they say. Remdesivir is not and never was approved by the FDA. Even previously, the drug has been out for a few years, okay? It has never been passed with the FDA for anything. So this is a drug that's been out there, not necessarily on the market, but it's been out there. Meaning it was already developed, research and development, and it was previously researched and developed for Ebola. It's a broad spectrum antiviral. So basically what that means is there's a spectrum, and this is for bacterial, this is for viral. And you're either on this side of the spectrum, or somewhere in the middle or somewhere along the way. This is a broad spectrum, which means it's normally, when it's a broad spectrum, either antibacterial or antiviral, it's normally a very powerful drug because it's meant to cover the whole entire spectrum when they don't know where a virus lies on the spectrum, because it's a novel or new or not highly researched, because it's normally linked to a pandemic type of virus or bacteria. So when they don't know enough about it, using a broad spectrum is a good way to tackle it, because they don't know really too much about the virus or the bacteria that they're dealing with. So a broad spectrum will cover all areas of the spectrum, and they hope that by using a broad spectrum, it attacks it no matter where it is on the spectrum. However, it's normally a very strong drug. Remdesivir has never been used long-term on anybody. So knowing the amount of side effects are very hard to do when something hasn't been studied for a very long period of time. So concluding that for the general public in layman's terms, risk factors are basically unknown. What they do know about it is liver. It increases your liver enzymes, which can result in liver failure. It can also increase liver enzymes, can also, when you take a test and they know your enzymes in your liver are elevated, unusual levels, that can indicate liver damage or liver failure. Basically, your liver is not doing its job in removing those enzymes. So Remdesivir right now, again, is a highly experimental drug with very little research documented. When it was being used for Ebola, they stopped the study. They have never, to my knowledge, I did not find anything else Ebola was ever studied on or attempted to try on. So far, they have some COVID. I think it's like a month worth of data and information on patients that they've used it, and a few associated deaths, whether or not it was from COVID, meaning the drug was not able to stop the virus from spreading and taking over the patient's body and they died from COVID, or they died from Remdesivir being added. But what they're saying right now is that the correlated data, and what correlated means is that there's an average of data. So basically, for the most part, this is what happened on most of the patients that used it. The correlated data, when analyzed, said that basically the data, the abundance of data that they received, 7 days shortened span of recovery. So basically it knocks 7 days off of recovery for most patients. So they recovered 7 days quicker. Okay. That's the growing consensus of correlated data. Now, there's not enough data to know the associated risks, especially for long-term use. So it is highly experimental. I don't want people to rush to the gammon thinking that we solved this. We didn't. This is highly experimental. Like I said, this drug has been around before COVID, and it's still never passed FDA approval for anything. They tried it on Ebola. So originally it was an Ebola medication. It was designed to tackle and treat Ebola. And it was highly ineffective. And Ebola is a very rapid virus as well. So if they notice that there is an increase in enzyme load in the liver, trust me when I say it, it was a very short-term use, like a few weeks, and it already increased the enzymes in the liver. So what that says to a person like me who analyzes and understands risk factors, this is not something you want to use on small children. It will leave them with permanent liver damage. This is not something you want to use on elderly because they already probably have liver damage. This is not something you want to use on anybody who's already experiencing some form of liver damage. So basically, healthy, middle-aged people without liver damage. That's what they know about it. And like I said, the studies, trust me when I say it, at most were only a few weeks long because Ebola is very progressive and Ebola will kill you within 14 days as well. It's very similar to COVID in the fact where it's rapidly progressing. So let's just say this. Remdesivir, again, if it's offered to you and you have COVID and you're in the hospital, again, that is at your own risk. Understand it is experimental. There is not a lot of data on it. You probably will be entered into a study. If you do decide to do it, please agree to the study because it helps us figure out for others, doctors, researchers, and scientists, what associated risks are with it if there is death, a high mortality rate associated with utilizing it and using it to try and combat coronavirus or COVID-19. Don't forget Ebola. I'm pretty sure, don't mark me on this. I'm pretty sure though Ebola is also a coronavirus. They stopped the study. They did not approve it for use for Ebola. So they haven't approved it for any use. They haven't even passed it in the FDA to be safe. Okay, FDA has to know associated risk, mortality rate, and whether or not it's safe. So, and whether or not it's effective before the FDA can approve anything. Because we're dealing with a global pandemic, the FDA has opened the gate as what they're allowing, and they're allowing a lot more under experimental terms where it's not FDA approved, but it's FDA like basically the FDA is not approving it, but they're basically saying we're not going to stop you from using it as an experimental drug, okay? So I don't want anybody to get any false hope out there. Understand there's a lot we don't know about the associated risks of Remdesivir, okay? I know we're all looking for hope and a way out of the storm indefinitely, but we are nowhere near there. Now, I speak of Cure 19. Again, one thing, you know, it hasn't even hit trials yet. I can't speak much of it at all, realistically, but all I do know is it's got very minimal associated risks, the way it's designed. That will prove itself in the study to be true or false, but from research aspects, it has very minimal associated risks, very minimal complications with previous medications, and it is a more one-size-fits-all. So it indefinitely will cause, you know, help more than harm. But again, these are all things that need to be done in a controlled environment, in a study. So when we're there and we're ready to do that, please, you know, help us out by entering into the studies, agreeing into the studies. But again, I do understand everything is experimental, okay? Something else I just wanted to mention on, let me just go through Remdesivir because I have it. Oh, I didn't have it pulled up. Sorry. Okay, so I'm going off the top of the head. That's right. I thought I had it, but I did some even further research and I looked at something else. So let me talk about that for a minute, okay? There is a drug that is, see, they keep looking at antivirals because this is a viral infection. I also strongly advise to look at antivirals way back in the beginning when I started Do Your Part Coronavirus because it's a viral infection, right? But I went one step further today. I looked at an antiretroviral. And an antiretroviral is meant to attack the viral load and bring the viral load down. Okay? So I looked at something called SYMTUZA. SYMTUZA, SYMTUZA. It has already been FDA approved. It is an HIV drug. It's meant for long-term use. Plenty of studies on it. It's been FDA approved, which is a good thing because FDA approval normally means low, very low, if none, mortality rate. Okay? Also designed for long-term use. So the associated risk factors are normally over a study of 6 months to a year at least. So it's designed for long-term use. Normally used for HIV to knock down viral load, to keep the viral load low so it doesn't overtake your body like COVID does and very rapidly. I think this is where we need to look right now. This is not what I was thinking about for Cure 19, just so everybody knows that it's completely separate, okay? But SYMTUZA, something new that just came across, you know, in some of the research I was doing was let me look at antiretrovirals now for HIV. So I'm looking at SYMTUZA. Okay, right off the bat, it does say used without any other antiretroviral. Okay, SYMTUZA is a prescription medicine that is used without any other antiretroviral medicines to treat human immunodeficiency virus, HIV-1, infection in adults and in children who weigh at least 88 pounds or 40 kilograms. So you have to be above the weight of 88 pounds or 40 kilograms to use this drug. Who have not received anti-HIV-1 medicines in the past, so it has some sort of reaction with any other antiretroviral medicines for HIV. So if you have HIV, you may not want to take this if you've taken something else. When their healthcare provider determines that they meet certain requirements. Okay, so now we need to start looking at, we need HIV doctors to jump on the bandwagon here and tell us what they know about this virus. We also need to look at patients with HIV who also contracted COVID, who may already previously be taking this. Maybe they didn't end up hospitalized because they're already on this. So it's a deterrent to the virus, to COVID or coronavirus. It's a deterrent. So basically, just like zinc was a coater and protector of the cells, same with this. It's an antiretroviral. So basically what that means is it doesn't necessarily go to work. Like, it doesn't help your T cell count go up to attack the virus. Basically what it does is keeps that viral load down, so there's not much to fight off. Okay, so that's why I started looking at antiretrovirals. Okay, SYMTUZA does have some serious side effects. Worsening of hepatitis B virus. So if you have Hep B, you may not be able to take this. Change in liver enzymes with people with a history of Hep B or C infection who have certain liver enzyme changes may have an increased risk of developing new or worsening liver problems during treatment. Okay, that's a category of people with Hep B or C. They notice some liver issues. Severe liver problems. In rare cases, severe liver problems can happen and can lead to death. Okay, so again, liver. So they tell you some signs of liver damage: whitening of the eye, yellowing of the eyes, dark tea-colored urine, light-colored stool, loss of appetite for several days or longer, nausea, vomiting, and stomach area pain. But again, a lot of these drugs are designed for long-term use. For something like COVID, as when we're talking just fighting the COVID infection, not post-COVID syndrome, which now they have a name for that, okay, which is the long-term or lifelong effects after suffering from COVID. We're not talking about that. Let me just be very clear. We're not talking about using this drug for post-COVID syndrome, although it's not to say we can't. I'm just not concluding that. I'm concluding right now just using this drug for COVID as an experimental, as a trial to see if it works. Now, like I said, these drugs are designed for long-term use, so anything used over long-term can destroy your organs, your heart, your kidney, your liver, normally the most ones to be affected, okay? Because it gets in your bloodstream and it's filtered. If it gets in your bloodstream, it runs through your heart. So your heart, any long-term use, and painkillers, okay, constantly running through your heart will wear down your heart. Then filtering through your kidneys and your liver before it's excreted through your bladder. Normally your kidney and your liver and your heart are the three organs that are affected from any long-term use of any prescriptive medication, especially things like painkillers and like strong antiviral type of medications that you use on a long-term basis. So this is nothing abnormal. Understand that. This is highly expected from drugs of this nature that are designed for long-term use. Not to say it can't happen in short-term use, but it's more so long-term use. So if it's used on a shortened time period, it may do nothing. Like, there may be no risk factors. May, not indefinitely, but may. Let me be very clear, because I know some people like to run to the gamut when they hear one little thing. Let me be very clear and very specific. Don't jump the gun. May, okay? More than likely, but may, okay? So now if you already have liver issues, this is probably not the answer for you. Okay, so SYMTUZA may cause severe or life-threatening skin reactions or rashes. It also says to look out for fever, tiredness, muscle or joint pain, blisters or lesions of the skin. Lesions are like open sores, kind of like blisters, but blisters have a pus pocket, okay, and lesions are open, like a pus pocket burst, and it's open sore. That's a lesion. Mouth sores or ulcers, so basically like cankers inside the cheek. Red or inflamed eyes, like pink eye or conjunctivitis. Remember, pink eye is viral, conjunctivitis is bacterial. So if your eyes start to get puffy, sealed with that crusty, type of nastiness, and a lot of built up Mr. Sandman in the corner of your eyes, that's typically conjunctivitis. Your eyes can also go red with conjunctivitis, or your eyes go red with pink eye. Don't forget, pink eye normally doesn't produce that mucus so much. Okay, that's more conjunctivitis. So that's the difference. So these are things to look out for when you're taking SYMTUZA. Okay, these are things that you may need to stop. Like you may have to stop it depending on how bad your rashes are, your lesions, your cankers, your conjunctivitis. Why should I not take SYMTUZA? Okay. Don't take SYMTUZA with any of the following medicines. Excuse me, because this is why I'm not a doctor. Another reason I'm terrible at pronouncing medicine names. So bear with me if I'm not saying these correctly, but it says do not take with alfuzosin, carbamazepine, cisapride, colchicine, if you have liver or kidney problems with colchicine, dronedarone, L.I.F.E. So that's in the classification as Remdesivir. So you can't mix these two. Or at least that's what I believe, because it's got the Zvir at the end. So that's more than likely going to be classified with Remdesivir too. So you don't want to mix this with Remdesivir. So it's Albuterol and Grazoprevir, okay? Ergot containing medicines such as dihydrogotamine, ergotamine tartrate, methylargotamine, ivabradine, lamotipide, levastatin, or a product that contains levastatin, lurasidone, midazolam when taken by mouth, naloxone, phenobarbital, phenytoin, pimiozoid, renolazine, rifampin, St. John's wort. Interesting, St. John's wort. St. John's wort is a supplement that acts as a calmer. Some people take it with psychiatric issues that are high strung, or really stressed out, as a natural option. So sildenafil, when used for pulmonary arterial hypertension. Simvastatin, or a product that contains simvastatin or triazolam. Okay, so there's a lot of drugs that this should not interact with. So this is definitely something you need to discuss with your regular doctor, or a physician that's not your regular doctor, but make sure that you consult highly with what you're already previously taking or have. Here's another thing people don't realize. Just because you're not taking it currently, if you had taken it a week ago, 2 weeks ago, it could still be in your bloodstream. Any drug. So you want to indefinitely consult with a doctor prior to rushing to take this. So if this starts to be studied, which I'm pushing this information out there, so hopefully it will. If it starts to be studied, you definitely want to discuss these things with your doctor prior to, while you're still capacitated, while you can still communicate for yourself, to find out if anything your previous medications or conditions would stop you from trying this experimental drug. It's FDA approved for HIV, okay, as an antiretroviral, but now for COVID we're talking, which is completely different because it would be considered experimental for COVID until it's FDA approved use for COVID treatment, okay? But this is something you want to discuss with your doctor prior to, because if you end up in the hospital incapacitated and you cannot communicate for yourself, and God forbid somebody close to you does not know everything that you're on and everything that you have taken in the past month or so, you definitely want to discuss this before that ends up happening to you, so you know going into the hospital, or your loved ones around you going into the hospital, you can tell them that you're okay to take this or not okay to take it because of certain drugs you may have previously taken, okay? So now the only thing really is, previous conditions, not medicines, conditions, and definitely is liver problems. So if you have liver problems or you're under the weight of 88 pounds or 40 kilograms, definitely not. So this is not going to really be good for small children who obviously are under 88 pounds. Okay, so we got through all that. Now, serious problems can happen if you take any of these medicines with SYMTUZA, any of the medicines that I just listed. Okay, before taking SYMTUZA, tell your healthcare provider about all of your medical conditions, including if you have liver problems, like I just mentioned. Oh, sorry, I forgot, including Hep B or Hep C. Okay, that's another thing. If you have Hep B or Hep C, you want to stay away from this. And also, if you take any other antiretroviral medicines, they cannot be mixed. Have kidney problems or allergic to sulfa. I had a feeling. You know what? I didn't even get this far when I read before I jumped on camera. Sulfa. Sulfa, I'm on a pathway with sulfa right now, believe it or not, in some of my research, but I can't conclude anything yet because it's just floating there in the back of my mind. So this is a sulfa base. So if you cannot have sulfa, you don't want to take this because you will have an allergic reaction. Okay, so sulfonamine. It's fine, I'm not a doctor. How do you say it? Where did it go? Sulfonamide. Sulfonamide? I believe I'm pronouncing that correctly. Okay. They say don't take this if you have diabetes. You must interact with the insulin of some sort. Or hemophilia. Hemophilia is a blood disease. Or have any, I believe hemophilia is you don't clot either. So if you get cut, you may bleed out. Or have any other medical conditions. Okay. Are pregnant. If you become pregnant while taking SYMTUZA or plan to become pregnant, it is unknown if SYMTUZA will harm your unborn baby. Okay. That knocks off another category of people. People who are pregnant or planning to become pregnant in the near future. Okay. Because like I said, things last in your bloodstream still for like a month or so. SYMTUZA should not be used during pregnancy. Are breastfeeding or plan to breastfeed. Do not breastfeed if you take SYMTUZA. Okay, tell your healthcare provider about any and all medicines you take, including prescriptions and over-the-counter medicine. So this medicine has a lot of counteracting issues, okay? So not a lot of side effects, not a lot of long-term damage, but it counteracts with if you have Hep B, Hep C, and it counteracts with a lot of medications. Again, broad spectrum antiretroviral. Very powerful drug. When you have very powerful drug, one of two things happen. A lot of risk factors or a lot of coinciding reactions with other medications. or allergies. So, you know, if you're healthy as a goat normally and you don't have Hep B, Hep C, liver problems, you don't plan to become pregnant or not breastfeeding, and you're not taking any previous medications, this may be an option. But again, may. And like I said, this has not hit trials. I'm pushing it out there so it will be experimented, okay? But if you fall into those categories where you don't have Hep B, Hep C, you're not planning to become, or you're not pregnant or breastfeeding, and you don't have previous liver issues, if this study is offered to you, please sign up, because this could be a viable option. Okay, so do not take new medication, even including over-the-counter, with SYMTUZA. Okay, what important information should I know about SYMTUZA? Immune system changes can happen in people who start any HIV medication. Don't forget, this was FDA approved for HIV. It's already been on the market and FDA approved. Low mortality rate. Immune system change. New or worse kidney problems, including kidney failure. Too much lactic acid. Let me break that down for you a little bit. Lactic acid is the acid inside of our muscles that when we're sore. So you go to the gym, you may have a buildup of lactic acid. If you have injuries like myself, you may have a high buildup of lactic acid in your body. So it says too much things to look out for. These are possible side effects. Too much lactic acid in your blood, lactic acidosis, okay? So that's lactic acid. It's that chemical that's released from your muscles when your muscles are sore and you rub on them. When you go to massage therapy, it's what the whole purpose of massage therapy is to release the lactic acid in your body, and that's why they tell you drink a lot of water afterwards, because you want to flush that lactic acid out of your body, okay? Okay, too much lactic acid is a serious but rare medical emergency that can lead to death. Tell your healthcare provider. Like I said, you just got to stay hydrated. Lots of water. Make sure you're flushing any lactic acid out of your body. And that's just on the regular. You know, if you work out, you want to drink a lot of water. You get a massage, you want to drink a lot of water. Acupuncture also, you want to drink a lot of water to release that lactic acid out of your body. Flush it out. Okay, diabetes, that's another thing I kept saying with this. If you have diabetes, some people who take protease inhibitors, including SYMTUZA, can get high blood sugar, develop diabetes, or your diabetes can get worse. Tell your healthcare provider if you notice an increase in thirst or if you start urinating more often while taking SYMTUZA. So if you have diabetes, it's not to say you can't take this, it's just to say you have to monitor it, because you may have a lot of changes in your diabetes. The way you monitor it previously and treat it and deal with it and cope with it previously may change, because changes may happen within your diabetes. It may get worse. You may require more insulin. You may require more monitoring. So just if you do have diabetes,